Hi, thanks for stopping by our poster today. My name is Carolyn Tague, and I am the program manager and lead instructor for a hospital-based massage therapy fellowship program at UCSF STAD Center in San Francisco. So it's my pleasure to walk you through our poster presentation. And again, thanks for stopping by. This poster represents a year's worth of massage therapy fellows work in an adult inpatient hospital. Um, you can see the background there. I won't read the whole poster for you, but just to say that the objectives of this study were to evaluate whether a standardized inpatient massage therapy session can improve common symptoms, such as and functional mobility among hospitalized adult patients across multiple inpatient services. So our PI, Dr. George Yeung, and this amazing team of UCSF physicians and researchers, along with our fellows, our hospital-based massage therapy fellows, provided the data for this retrospective study. So the analysts looked at the EPIC chart records and they came up with this information. So again, I won't read through all of the methods or the patient characteristics. You can see that there. The one thing that I will point out is that there was data collected by the massage therapists pre and post session, and that information is valuable and it's patient self-report. However, there is a known kind of bias because it is the practitioner collecting the data, so it has that known bias. In addition to that information, this study also looks at the daily average pain scales collected by the nurses the day before the massage session, as well as the day after. So that significantly limits the bias that might be otherwise found. It does lead to other questions, and so further studies are also recommended, but it does I believe, greatly eliminate the issue of bias in the pain scale and the scores collected. So again, I think this is relatively new and unique information for this particular study. So happy to be able to share it. So you see the patient characteristics there. And reasons for consults. So let me get out of the way. So you can see the studies here. So the big table graphic in the middle is the massage therapy fellow collected data for pain, fatigue, anxiety, and nausea, and all with a significant improvement in symptom post-session in the moment. So lovely to see and significant. And again, it does have the bias because it was collected by the therapist. The two graphs below are data collected by nurses. And so the first one is the pain, the average daily pain prior to the session. And then the second is the day after. And that does show a nice improvement as well. So very happy to see the reduction in pain as collected by the nurses. And then the third table is, again, what I think is, I don't believe it's been published before. I could be wrong, but I don't know of any other study that shows an improvement in functional mobility. So this is for baseline. So the conclusion, I can read that over here for you too. A single inpatient massage therapy session was associated with significant improvements in pain, anxiety, fatigue, and nausea among hospitalized adults. And patients with low baseline mobility demonstrated greater improvement in functional recovery. So again, really excited to see this data. It's an amazing team that put this together, and we're looking forward to doing future reviews with our pediatric patients going forward, but happy to connect with anyone who's interested in this work or any follow-up. Again, it was collected retrospectively with our EPIC electronic health record system and this amazing team that analyzed this important information. Thanks for watching.